Okay, so my patient today is Jack. He has some pain on his left side of his neck, and we're thinking this is due to the intervertebral foramen being squeezing a little bit on his spinal nerves, and the reason is because he's having some pain down his arm and some also paresthesia distal to the left elbow. And so what we want to do today is some cervical traction. We want to make sure, though, with their cervical traction, that he hasn't had any acute strains recently, that he hasn't had any neck surgeries, especially stabilizations, no prosthetic discs or spinal implants. And also, we want to make sure that it doesn't cause any more pain, like so it doesn't peripheralize down the arm. Let's see here, did I get that? Some of the indications, again, we want to do traction because we want to kind of open that foramen up a little bit. So specifically, what we want to do is posterior or flexion bias traction, so that it not only pulls the discs up, but it's going to put the vertebral disc forward and open that vertebral foramen up a little more, so that it relieves pressure off the spinal nerve. So here's Jack. Jack, how are you doing today?
Doing good.
Good. My name is Jesse. I'm a student physical therapist at Rocky Mountain University. And so for your left neck pain, we want to do some cervical traction today.
Okay.
And so what we think is going on is that your spinal nerves come out of little holes in your spine. And we think that those holes are kind of squeezing them a little bit. And so that traction is going to kind of help open that up. How does that sound today?
It is.
Awesome. Okay. Well, have you had any surgeries on your neck before?
No.
No surgeries on your neck? No prosthetic discs or anything like that? Okay. Any strains or anything? Any injuries on your neck recently?
Nope, just a little bit of pain.
A little pain. Okay.
Yeah.
All right. All good. So I'm going to have you come up to the table here, lay on your back. I want you to put your head. Well, you might need to scoot down just a little more. Okay. Awesome. We want to make sure. Yeah, and even scoot down just a little more. Yeah, perfect, just like that. We want these neck thingies, I guess. I don't know. They want to be right next to the mastoid process. So before I continue on, we have this little button here. Okay. And what this does is you can press it and it'll stop the traction. Okay. So if any pain starts happening, if the pain starts moving down your arm, we want it to stop. So you can just press that button. Okay. Okay. Perfect. Just like that. Now what I want to do is I'm going to tighten these, not until it hurts, but we want it to be snug, all right?
Sure.
So tightening right now.
Yeah. Still okay. It's getting snugger. That's pretty good.
That's pretty good. Okay. Awesome. Now I'm gonna put this little strap just over your forehead like this. It's just gonna help you here.
Sure.
This is not gonna be quite as tight, but we want to make sure it's good and snug as well. Does that feel okay right there?
Yeah, I'm comfortable.
Okay. Now we're going to set the parameters. For him, what we want to do is, one, we want to make sure that the neck position is 20 to 30 degrees so that we bias flexion. We want to traction force about 7 to 10 pounds, and we want the traction time to be about 5 to 10 minutes. All right, so let's come over here. We want to take traction, and we want to do posterior manual. All right, and I don't know actually how to change the time here. Oh, here we go. I'm going to switch the time to 10 minutes. Click done. All right, so now I'm going to let me know. Okay, so I'm going to go up to 7 pounds to start off with. All right, how does that feel? Feel a point? Good. All right, so I'm going to click start. And we want manual. How many progression steps? Just one. And done. Okay, and start. Need to be up a little. Oh, there we go. It needs to be at 8 pounds. All right. Okay, so we started the traction now. And so we're going to leave him here for just a little while. How's it feeling right now? It's kind of nice? Awesome. Good, good. We're going to wait about 30 seconds. Again, if you're having any pain or irritation at all, if the pain is going down your arm on the left side or on the right side, we want you to hit the button. Okay. All right. It's been about 30 seconds. I'm going to stop here. Okay. So now what we're going to do, Jack, is I'm going to undo the strap. We can even loosen the thing up there, but we want to make sure that you don't sit up immediately because that's going to essentially just undo everything we just did. Okay. All right. I'm going to reach across here. I'll loosen this up here. Oop, that's the wrong way. Is that better?
Yeah.
All right. I'll take this from you. Okay. How are you feeling?
Yeah, I'm relaxed.
Good. Okay. Let's check here. Machine setup. All right, and I think we're all done.